Good afternoon and welcome to our YouTube channel. This afternoon we want to look at dosage calculation in terms of the number of tablets or a number of capsules we want to administer. So if you are watching us for the first time, subscribe to our YouTube channels for more videos and insights. So let's get started and let's look at how we are going to calculate drugs in terms of finding the number of tablets, finding the number of capsules we are going to administer in a particular situations. Let's get started. If the doctor orders for you to give 500 milligrams, okay, of drug, let's write the drug E. Maybe we are going to say of drug X, okay, and the available stock you are going to have, or the available stock you have in the wards is, for example, 250 milligrams. Now the question can be, how many tablets are you going to administer of drug X? So we are going to follow a simple formula here, which is it doctor's order over the available stock times the 1 tab. Okay, this is what you are going to follow. So what has been ordered is 500 milligrams. So we are going to say 500 milligrams, of course, over the available stock. The available stock or available strength is something you have in a particular word. So for example, here we have a 250 milligrams. So we are going to say 250 milligrams. Okay, times the 1 tab. So of course in pharmacology, units are very, very important. So we are going to start by cancelling out. Milligrams and milligrams goes. Okay. Then you are going to remain with 250 into 500, which is 2. And you bring back your tablet. So in this case, when the doctor orders 500 milligrams of drug X, and in the word you have 250 milligrams, so meaning you need to administer 2 tablets to the patient. This is example 1. So make sure you follow the units correctly. So let's look at example number 2. Welcome back. Let's look at the second example of dosage calculation or finding the number of tablets. So in this case, in our example number 2, let's imagine the doctor or the physician orders ibuprofen. Okay, ibuprofen, we are going to say 600 milligrams. 600 milligrams. And in this case, what you have in the word is, for example, 150 milligrams. So again, we are going to go back on our formula. We are going to say the doctor's order over the available dose, and our available dose times the 1 tab. So from here, we are going to replace 600 milligrams, which are going to divide by 150 times the 1 tab. Here units cancel this one into this one, it will give us 4 tablets. So in this case, you are going to administer 4 tablets. Then, on the same one, let's look at example number 3. So in our example number 3, let's imagine the doctor or the physician's orders paracetamol. Orders paracetamol, we are going to say 750 milligrams. And what we have is 250 milligrams. How many tablets are you going to administer? So again, we are going to go back to this formula we have here, which is doctor's order over the available strength times 1 tab. Then as usual, we are going to say the doctor's order is 750 milligrams. Then we are going to divide by 250 milligrams times 1 tab, which is going to give us, if 250 there, it's going to give us about 3 tablets. So we are going to give 3 tablets of paracetamol. Let's look at the other or the last example of dosage calculation under this simple cancellation formula. In this last example, our example number 4, we are going to say, for example, the doctor orders Lasix or furosemide. Okay, we know these are antidiuretics which we give in hypertensive patients. So, for example, furosemide. Okay, the doctor orders furosemide 40 milligrams. And what you have, or the available stock you have, it's 20 milligrams. So again, in finding a number of tablets you are going to administer to the patient at that particular time, you are going to use the. So we are saying the doctor has ordered 40 milligrams, and what you want to administer, or what you have in that particular one, it's 20 milligrams. So I'm saying you need to go back to the formula. The doctor's order, okay, then we are going to divide by the available strength or stock available, then times 1 tab. Then, of course, our doctor's order is 40 milligram. Then we are going to divide by 20 milligram of what you have in that particular what, then times 1 tablet. Then milligrams and milligrams will go. And of course, after milligrams and milligrams goes, you are going to remain with 40 over 20, of which, if you want, you can go there. 2 into 2, of course, it's going to give you 2. And remember, tablets remains. So you are going to administer 2 tablets of Lasix. So thank you very much for watching our YouTube channel. For now, all what we can say is subscribe for more insight and videos on simple dry calculations. Thank you very much.